Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. What are the treatment options for low sperm count? This is a question that patients ask us very often. When a couple arrives for fertility treatment, the first thing to do is a whole battery of tests for the male and the female. Unfortunately, for the female, the list is longer. It involves ultrasonography, blood tests, physical examination, so on and so forth. For the male, the first investigation that is suggested is a semen analysis. Based on the results, a lot can be deciphered, and then further investigations and treatment options are then given to the couple. So, what are the treatment options for a couple when they are dealing with low sperm count? The treatment will basically depend on how low your count is and what is the cause of this low sperm count. So, that's very critical for a fertility specialist to decide on what kind of treatment to give you. But broadly classifying these treatment options, I can tell you that there are 6 major important ones. First is surgery, second medication, third counseling, hormonal treatment, lifestyle modification and alternative medicines. They are not in any order because the treatment options depend on what kind of problem you have and what is it that the fertility specialist thinks is the best option for your treatment. Let's talk about the surgical option which is available. Surgeries are usually performed on patients that are complaining with large varicoceles and they are causing a lot of damage to the sperms that are being produced in the testis. Not only that, they also block sperms from being transported outside. So these kind of varicoceles need to be surgically addressed. Therefore, surgical evaluation, surgical intervention in cases of varicocele are a very mode of improving your sperm production. Not only this, blockages can also be caused due to these varicoceles. Like I said, those also can be removed and therefore sperm count in the semen can be improved. Next is if there is no sperm present in the ejaculate due to some anatomical problem, like if there is a problem in the penile anatomy or there is an issue in the prostate or seminal vesicles, these also can be addressed by surgical intervention. So, depending on the cause, the treatment options are given. Also involved in surgical treatment are the treatment for azoospermia, as in when the sperms are not being formed in semen and the reason is obstructive blockages in the transport. That's when surgical intervention is required and surgically extracted sperms are used for treatment. There could be microsurgically removed, they could be percutaneously removed, they could be aspirations or they could be biopsy or a small piece of testicular tissue. So these are very critical and they change the way your treatment is performed. If there are sperms present, there is a high chance that you can be a father and you can use these sperms for treatment options. Previous vasectomies can also be corrected by surgeries. So in case you decide to reverse the vasectomy and in case you decide that you want to have more children, that's when vasectomy is reversed and there is a high chance of improvement in the sperm count. Therefore, these sperms can either be used for a treatment of infertility or the sperms can improve to an extent where you can try naturally and get pregnant. Next treatment option is medication. Sometimes there are some infections which are the root cause of low sperm count. These infections have to be treated and once treated, the sperm count can be drastically improved. Of course, for any improvement to be seen, a duration of minimum 3 months is required for you to know whether the medications that you have taken are of any use or not. So, to understand whether you have infections or not, the proper investigations are required. Your fertility specialist will do all the tests and then based on the infection, these medications are administered, after which a duration of 2 to 3 months is let to pass by and a semen analysis is done again along with the infection analysis to rule out the presence of any more infections. The next mode of treatment is counseling. Counseling is a very simple treatment option but very important. However, I have to mention that it's often ignored. Counseling is very important in addressing problems such as erectile dysfunction or sexual intercourse issues or premature ejaculation. If a male can come out and express the problem that he is having in these particular forms that I have talked about, a lot can be discussed and the root cause can be evaluated and treated. More often than not, these problems are psychological. They have to be addressed. The cause of this problem has to be evaluated. Is it a childhood trauma? Is it stress that you're going through? Is it a medical condition such as diabetes or hypertension, or you've put on too much weight because of which proper hormonal circulation is not happening, due to which you're not able to perform sexually? Is there sexual performance anxiety? All these have to be evaluated properly, and counseling is one form of treatment where if you address the root cause of the problem and you're made aware that there is a problem, you can address it on your own. However, counseling is not looked with respect, especially in India. When you think that you can solve anything through counseling, you don't give it much importance, and it's not an expensive treatment. Therefore, we often think that it won't work. But when a patient is undergoing infertility treatment, many times to be able to just handle the stress of treatment, to handle the stress of a negative, it's very critical that you go through counseling. And as I said, low sperm count can also be addressed by proper counseling. Next are hormonal treatments. When the hormones are not balanced in the body, there is no proper production of sperms. For example, if testosterone, follicle stimulating hormone, which are very critical for sperm production, are not produced in the body by the pituitary and the signals are not reaching the testes, then sperms are not produced. This can be evaluated, and hormonal therapy can work very well in such cases. So it's very critical that you do not take a self-step. Your urologist will decide what works best for you. Hormonal therapy does not work for everyone, so they need to decide what works for you, and a certain period of time can be let to pass to see if there are any changes or improvements from the hormonal therapy. Lifestyle modifications also play a very important role when it comes to improvement of sperm. If you are having intercourse once in a month, it will not work. Please keep a track of the ovulation of your partner so that you are aware of the good time to have intercourse. Do not use lubricants, do not use any oils that are spermicidal, that is the kill sperms. So if you have knowledge of how to enhance your success rate, definitely that will help in achieving pregnancy faster. But to improve low sperm counts, it's very important to alter your lifestyle if you are doing something wrong. So again, awareness and knowledge plays a very important role. For you to be aware that you need to lose weight, you need to maintain your health is very critical, and thereby there will be an improvement of sperm. A proper diet is also included in lifestyle modification. If you want to understand more about this, you have been diagnosed with low sperm count and you want to understand your treatment options and your best way of attaining success at pregnancy, please feel free to contact us. Thank you.
A lot of effort has gone into making this video. Please like and subscribe us. Thank you.